Thank you so much for joining me. My name is Jean Lee, and I'm working with Dr. Colleen Bono. So we are at Revolution Medical San Diego. You can find us at revolutionmedicalsd.com or at Instagram at Revolution Medical SD. We have two locations in San Diego. One is in La Jolla and one is in Bankers Hill. And you can call us for free evaluation. We are both emergency medicine physicians. I trained at Morristown uh, in New Jersey, and Dr. Colleen Bono trained at UPenn. So we are great at multitasking, and we love doing hands-on procedures. So this is a perfect fit for us. So I wanted to touch base on some basics about Botox. So we're going to talk about the history of Botox, how it works, and also we're going to talk about a little bit of the facial anatomy that's relevant regarding Botox. And so I'm going to be, some people are just joining the meeting, and so I'm going to be touching on the screen there. So how Botox works. Botox is a purified protein, and so it actually, what it does is it relaxes smooth muscle. So when you inject it into targeted areas in the skin, then it causes the muscles to relax. And with just some tiny injections, the cosmetic Botox will block acetylcholine release, and thus the smooth muscle will relax, and then you won't have as much wrinkles on your skin. So with less wrinkles, gradually, over time, you won't have as much wrinkles etched into your skin. So it does help with future wrinkle prevention. So one of the most common areas that people get Botox is between the eyebrows. It's known as the glabella area. And so when you have the brow muscles contract and we do like a furrowed or frown face, then these muscles cause 11 lines between the eyebrows. And as we get older, unfortunately we do lose collagen and elastin in our skin, and also there's some skeletal changes. So over time, your skin becomes a little more fragile, and with repeated, wrinkling, it can cause further changes in the skin. So that's where, over time you'll see that these 11 lines can form, and Botox can help with that. So just a little bit of history on Botox. So Botox was actually was discovered in the 1800s, and so interesting fact, it's actually Latin for sausage. So in the 1800s, this German doctor noted that some people got sick from eating sausages, and so then they named it after that. So it's actually that protein derived from a bacteria, and they inject that protein into certain areas of, usually in the face, and it's usually in the upper face. And it was initially in the 60s and 70s when they were using it for eyelid spasms and for blepharospasms and strabismus, so people that are cross-eyed. So then they noted that these people that had these injections around the eye, they actually had improvement in their appearance. And so they started using that for cosmetic reasons in the 2000s. It was very fascinating, I think. So since then, so it's been around for many decades. So I think one of the things that, and when I talk about Botox, I'm using it in a generic form. So just like people use Kleenex or Scotch tape, there are other brands of botulinum toxin or neurotoxins, such as Xeomin and Dysport, and there's a new one from South Korea called Jeuveau. And we've been using Botox, Xeomin, and Dysport, and have had good success with all of them.
So, Gene, if I can interject, yeah. They've also been using different forms of botulinum toxin A in Europe for many more years than we have. So it's been around longer than 2002 when the FDA approved it. The FDA approval takes so long in the U.S. Many of the treatments that you see here have been used in Europe for 10, 20 years before they actually make it here. So it has a really good track record, and Gene will go into it in more detail. I just wanted to throw that in there.
Yeah, I appreciate that. Yeah, it's definitely been around a long time. And also, let me know if I'm being too technical, so if I can explain myself a little more.
Oh, I love it.
So botulinum toxin is derived from this bacteria called Clostridium botulinum, and so there's many subtypes, strains of the bacteria, but the toxin that we use is the type A. So this is the anatomy. This is a nerve cell here, and it connects to the muscle, right? And so at this junction here, this is called the neuromuscular junction, and this is where acetylcholine is released, and that causes the muscles to contract. Now, when Botox is injected into the tissue, it gets absorbed into the muscle and then gets pulled into the end of this nerve axon, and then it blocks the acetylcholine release. So that's really it's really cool to learn about how it works. So some common areas that we use for Botox. So Botox helps with dynamic wrinkles. That's one point I want to bring up. So a lot of people, as we age, I mentioned that we do lose elastin and collagen, and so our skin gets less elastic. And so over time, with muscle contractions, it causes more and more wrinkles, right? There are some areas that we target, specifically the forehead, frown lines in between the eyebrows, the crow's feet on the sides of the eyes, and then there's also some other areas that we do in the lower face, such as bunny lines, or sometimes people have a gummy smile, or sometimes like a sad smile or downturned smile. That can be sometimes helped with that as well. In the chin area, some people get dimpling of the chin, and that can be improved with Botox as well. So some indications for Botox, so it's a specific muscle group that we're targeting when we inject small amounts of Botox. And so these muscle groups, you can see that they work sometimes in opposite directions. So like the forehead pulls the eyebrows up, whereas you have this is the glabella area. The glabella area have several muscles that pull the eyebrows together. And also you have a muscle around the eye called the orbicularis oculi, and that is more of a sphincter muscle, so it can cause the creases around the lateral aspect of the eye. So I just wanted to go a little bit through the anatomy of the face. So the major muscle on the forehead is your frontalis, and it's on both sides of your forehead. And then in between the eyebrows, you have three major muscles: the procerus, which is here, and then you have this muscle, which is the corrugator muscles on both sides, and those are the ones that we usually target as far as for frown lines. The orbicularis oculi muscle is the sphincter muscle, and that when that contracts, that causes creases on the lateral aspect of your eye. So just quickly to touch on why some people should not get Botox. There are major reasons. If you're allergic to Botox, if you've had it before and you had a major reaction, you should not get Botox. Also, we usually recommend not getting it if you have some severe neuromuscular disease, such as Lou Gehrig's disease or myasthenia gravis. Also, if you're pregnant or nursing, you should avoid Botox. So Botox, usually the results, people start seeing some results in usually about 3 to 7 days, but we typically will see major effect in about 10 to 14 days. So in general, we do ask people to come back in about 10 to 14 days after they get injections, just to see how they're experiencing the Botox, and sometimes people will need a little touch-up. So, but generally the results will last for about 3 to 4 months, on average about 3.5 to 4 months. Some people actually, so just to talk about some differences, some people do need a little more than others. It depends on muscle mass. So men in general will require a little more Botox because the muscles are a little larger and stronger. And also some people, because of lifestyle, so if you're high metabolism or you work out a lot, sometimes you may notice that the Botox may not last as long. So some people ask about how much Botox we'll need. So in general, on the forehead, about 10 to 30 units. In between the eyebrows, it's about 10 to 25 units. And on the sides, on each side, it's about 5 to 15 units. And sometimes, you can talk with your provider and say, if you want to start with a certain amount and see if there's any results. Sometimes for first-time clients, we do start with a little bit lower amount just because we've, if you've never had it before, we want to see how the effect is on you.
And Jean, I would interject also is that if you do go lighter, and a lot of people want to start lighter, especially the first time around, it's not that it won't hurt. It's just that it either won't achieve the effect you want, so it won't knock out the wrinkles if you want to take that movement away completely, or it won't last as long.
Right.
And so the duration of effect is also dose dependent. So if you go light and you get a good effect, but it only lasts 2 months, then the next time I would generally recommend to go a little bit heavier, and then that way you can try to get more longevity out of it.
Yes, that's true. Yeah, thank you for saying that. So I wanted to show some pictures of my own experience with Botox. So this is the first time that I had it done. It was at the end of December, and Dr. Bono had done it on me. So you can see that when I raise my eyebrows, I have some creases and forehead, and then this is me smiling, and you can see some crow's feet, and then my 11 lines in between the eyebrows. And then after Botox, you can see me raising my eyebrows. The forehead creases are significantly improved. The crow's feet is much better, and me frowning, there's hardly any furrowing of the brow. So that's great. I'm very happy with the results. I just want to show a little video because I think the movement is very important so you can see how it works.
Gene, I have a question.
Sure.
And great job, by the way.
Thank you.
So you're zooming it. What about working out? I mean, if you are, you go to the gym a lot and things like that, would you recommend taking 3 or 4 or 5 days off so, you're not exerting, especially like doing squats or, heavier exercise?
I think that's a great question. So when you're getting Botox, one of the great things about Botox is not just that it's safe, but that there is really minimal downtime. So after you get the injections, we generally do recommend that you stay not working out for about 4 to 6 hours afterwards, but you can go back to normal activity right after that. So the only thing that we would recommend also is that you avoid putting any pressure on your face. So like don't do any yoga where you're inverting your head. You don't want to exercise too much after getting the Botox injections because you don't want to get too much blood flow and causing migration of the Botox to other parts. Does that answer your question, Jonathan?
Yes, that does. Thank you, Dr. Lee.
Awesome. Yeah, so I think just to touch on that a little bit, I think some of the positives of Botox is that so it's got a long track record. So it's been around for many decades, and so it's been proven to be safe and effective. So when you talk about your expectations of getting Botox, first, of course, we want to talk about what your concerns are and why you want to get Botox, and whether this treatment would help with those concerns. Botox is very safe. It's been around for many decades now, and when you are treating dynamic wrinkles, Botox, we know how it works and how long to expect it to work. So I think that those are some of the things that when I receive treatment, that's, it's reassuring to know that it's safe, effective, and generally relatively inexpensive when talking about a non-invasive or minimally invasive treatment for wrinkles. Also, the downtime is very minimal, so generally about 4 to 6 hours after injections, and then you can go back to normal activity. And the procedure itself, so it does take, it's quick, so it's usually in about 15 to 30 minutes. You can be in during your lunch break, you can go get Botox and then go back to work. Some people may experience a little bit of swelling, but generally there's minimal side effects to the injection. So, some other things about Botox, men are getting Botox more now than ever. It was discovered in the 1800s, as we talked about, and unfortunately Botox does not help with sun damage. So there are other modalities that we do, some other services that we provide that would help with photo aging or sun damage. For example, like microneedling or chemical peels can help with that. So it does reduce sweating. So there are other indications for Botox, medical indications such as for migraines or sometimes cervical dystonia or hyperhidrosis or excessive sweating. So um, there's that. Botox is not permanent, so it's a temporary improvement in appearance, but it does, have some preventative features to it too. So I think that's an added benefit of it. And Botox is one of the safest procedures available. So, um, so just in summary, so Botox is a minimally invasive procedure. It's anti-aging treatment that helps with wrinkles, which is usually indicative of aging. So it eliminates that appearance and then makes people feel better. They usually look a little bit younger after that. So, all right. So thank you for joining me today, and I appreciate the the time that I can provide talking about this. So I can open this up to a Q&A.
Hey, Gene, I have a question for you.
Sure.
So you were saying that men may need to get more injections because we have more muscle mass.
Right.
Is the cost based on the number of injections, or is it based on like session, or how does that work?
Yeah, that's a good question. Some places, so most places will charge based on the unit, but there are some places that will charge based on the area. And so I would say that the cost generally is about 12 to $14 per unit. So right now we are doing for first-time clients, it's $10 a unit. But
okay.
Yeah, so generally for men, I would say when I received treatment, it was about 35 units for me, and that was my first time. And so I would say most men would be about 40, maybe 45 units total. But also depends on, obviously lifestyle and like how strong, I would say how strong an effect you want. Some people want more. I think that I think for my first time, I wanted to just see how it worked, and I think I was very happy with how it came out.
And Jean, if I could interject to Kenny as well, a lot of times, if you look at the average woman's muscle mass and the average man's muscle mass, it can be up to 40 or 50% more. And so you could expect that it could be, anywhere from almost double or a little bit less for a man to get full, frozen face if somebody wants no muscle movement. If you're just treating isolated areas like the crow's feet, I know a lot of men have said they don't care about their forehead or they don't care about certain areas. Then, obviously it's different. But I've had some very, very muscular, meaty guys come in that require double what a woman requires in order to freeze the muscle.
So like 80 units?
It can be. Mm-hmm. Now, and you're just looking at your face, you are, probably not in that category, but it really depends on how you respond too.
Did you just insult me?
No, I just said.
Hold on.
Well, we don't want to generalize that, but your face is not extremely large, and I've had some people that, you see guys that have really large heads and a lot of muscle mass, and so, just watching your face move also, you don't have a lot of movement on your forehead or between your eyes and around your crow's feet, so not insulting, I'm saying you have a very slender, athletic face.
I think I need to hit the gym more.
Too bad it's closed, right?
Yeah. So I wanted to tell you guys, why I got into aesthetics, and I wanted to ask Dr. Bono as well. So for myself, I got into aesthetics because I love working with my hands, and having an emergency medicine background, we're constantly multitasking. Plus, I love the direct one-on-one patient interaction, just I think we both have a great bedside manner, and just we're friendly, and we want to just we love meeting people, and I think that aspect of the aesthetics is what drew me, and so I'd like to hear from Colleen, if you tell me what was it that brings you to aesthetics.
Well, much of what you said, first of all, Gene, I want to say excellent job. You are wonderful. I think you're a natural. So I think we'll have many more of these. And I appreciate you putting the time into this. Both of us are still working, by the way, at our medical center where we work. And so Gene has taken his time in between, maybe using your free time very wisely to do this instead of resting. But so I appreciate you doing this, because putting these presentations together does take a lot of time, and I appreciate that very much. And I'm very grateful to have Gene in my life. He's my job share partner at the place that we work, and now also at Revolution Medical. And that'll segue into why I got into this. I'm 51 this year, so in a couple months I'll be 51. And Gene, you look fabulous for 75. I just can't believe it after all our treatments. But I was getting more and more treatments done myself, and as an emergency physician, frankly, while we're at work, we don't take very good care of ourselves. And I think most people in the medical field will see you're just kind of eating whatever, you're doing whatever, you're not getting very good sleep, and it just naturally starts to take its toll. And as I was doing more and more, I thought, this is really cool to be able to help people kind of freshen up their look. Neither one of us like the overdone look, so it's really to try to enhance your natural look and to replace some of the things that have gotten damaged over the years, whether it's by Botox or fillers or laser or whatever we're doing. And the hands-on part is definitely a huge part. Gene and I are both very procedurally oriented, and I think it was a natural draw. And frankly, as I get older, I like spending more time with the patients. When we were younger, I think we loved running from room to room and doing all of the exciting things and not having to spend too much time with any one person. But now, I guess with age comes wisdom and the appreciation for being able to form that bond with folks that, you just meet, and then being able to have a long relationship with them and help them over the years with whatever they need.
Yeah, I agree. Yeah, thank you. The other thing I think that we love is that, aesthetics, there's so much like innovation. So there's always new treatments that come out, or, so we were just in Las Vegas at the end of January, and we got to go to this AmSpa conference, the American Medical Spa Conference, and we got to network and meet a lot of different people that have been doing it for 8, 10, 20 years. And, you get to meet all these people, plus you get to do all these new procedures, and it's just amazing. I think it's great.
Yes. And Gene, if I could interject, I just wanted to comment on a couple of things you and I had talked about before. Do you have more in your presentation?
No.
Before I say anything?
Yeah.
Oh, okay. So one of the questions that came up was, why would you do it early? I mean, you have people in their 20s coming in and they have no wrinkles. And a big thing is that if you look at folks, and so far all the faces I've seen don't look like this, but you have friends that have these really deep creases in their forehead, deep creases around their crow's feet, and those creases form because of the repeated movement of the muscle. And so it eventually forms that crease in your skin, and it is harder to get rid of that crease than it is to prevent it from being formed. And I think the millennials get it, and they've seen their parents, mostly their mothers, going and getting Botox done over the years, and they see what they can do to prevent any wrinkles from forming. With that being said, once the wrinkles are there, or the creases are there, the Botox will help smooth them out, and depending on how deep they are, sometimes if it's superficial, it will help to lighten it up to where you don't notice it at all. And sometimes it'll just lighten it up, but you'll still see the wrinkle there. And there are various treatments to perform to get rid of those wrinkles once they're there. And that's what Gene is talking about, all of these cool things that come out. A lot of them are spin-offs from regular medical treatments or devices that are used. And so when the creases deep in there, you can do filler in some areas. You can also do collagen building threads or other collagen building items like sculpture and radius. So it makes it nice because it's almost like you're working on a canvas. It becomes very artistic. I'm losing my voice. I left my water outside. Sorry. The other thing I wanted to bring up is that because we all have, basically know where to go once we get home from work, we still want to be able to answer questions and perform our consults. And we can do those online and through FaceTime, because a lot of the time spent on your first visit is talking about the various things that we can do and talking about, what we see on your face, what you see on your face, and we can get that part out of the way, which would make your visit very quick once you come in, because we'll kind of already have our plan in place and decide, what you want to do and what you want to do first, and then get you prepped. And the other thing is that Jean talked about the skin damage portion of it, and skincare is a huge part of that. If you are following us on Instagram or following Jean on Instagram, we've been posting about the Skin Medica sale that's on right now. They never put anything on sale. And right now, if you go through our website and through the shop tab, you can actually get 30% off of Skin Medica, which they'll say this has never happened before, but they're trying to, keep people involved and get them to try some of the skincare. So I would highly recommend that. Jean and I both use it, and we both love it. There's a lot of science behind it. And with that, we're also offering whatever you purchase through the website link that you'll see through our website. You can get a 10% voucher for yourself and a 10% purchase price voucher for a friend for any treatment that you want to have done. So we're encouraging people to give it a try, especially now that it's so inexpensive, relatively speaking. And Jean can definitely talk to any of that. So can I. But we're both interested in talking to you and answering any questions you have. We got a lot of time on our hands compared to normal, so you might as well take advantage of it.
Yeah. No, I think that we are both, we care about everyone being home, and, hope everyone's staying safe. We definitely want to be here for you. And so this is also something that we've both been working on, and we want to be available. And so if you have any questions, we're available online or by phone, and you can ask us questions and we can evaluate you.
Jean, if someone starts using Botox and then at a later time, I don't know if the word is quits, is there any side effects to it? Is like withdrawal or?
Yeah, good question. Yeah, so Botox, people don't really develop tolerance to Botox the way that we, with the small doses that we're using. So I would say that people don't necessarily feel withdrawal. I think that it's something that if you use and you like, then you can always choose. You know that it's going to last for about 3.5 to 4 months, and then after that, if you choose not to continue it, you can. It's really based on individual.
And I think part of the question too is like, will your wrinkles come back with a vengeance or something? And that's not true. Your face will just start moving again. That's all. And whatever sequela from that, if it's moving for another 10 years, you might get some etched in lines there. But I have people that do it just once a year, like around the holidays, because they want to look nice when they're around their family, and then they don't continue it. But most people are in every 3 months on a regular basis. And I think, Jean, now is a good time to also add that there are rewards programs for people that do it on a regular basis. So right. Kenny, if you're wondering like, oh my gosh, is this a sustainable thing to do, especially since kind of the economy is in danger here, they do have rewards programs. So every time you come in, you get basically cash to be used for your next treatment. So, the more you come in, the more cash that builds up in there, and it gets applied to, like through Botox, you can use it for your Botox, your filler, your skincare. And oftentimes they have special deals where you can, buy $100 worth for $75. So once you get involved in these programs like Brilliant Distinctions, which is the program for Botox, or Allergan. And then there's another program called Aspire, which is for the Galderma products, which includes Dysport and the Restylane products, as well as Sculptra. Then you build up money every time you come in. So at least you have a little bit of extra cash there to spend.
Yeah, so I think that's a good point. I mean, maybe talk with your, provider, or talk with us and see like what promotions there are, that you can get where, and also maybe talk about what your concerns are, what your plan, that you can come up with a plan and say, this is something that this is the area that I'm concerned about. How can we address this, right? Because I think everyone has a little bit of different priorities as far as their skin, and for me it was like some pigment that was really bothering me. That was one of the things that was really like on my cheeks, right? So when I turned 40, that's when I started noticing more of these skin pigments on my cheeks, and so it was a constant reminder that I'm 40, and so I started looking into different ways of trying to treat it. And so Botox is not going to help with the pigment part, but it's part of the treatment plan as far as making when I look at myself, I feel better, And I think so. There's like certain creams that you can put on, or sometimes with microneedling or skin peel, sometimes can help with that too. So I think there's if you talk about like the different treatment modalities that will address your specific concerns, I think that's the way to approach it.
Yeah, on a general consult, they'll ask you what is bothering you and what things you want to have addressed, and they can, talk to the different modalities to fix the things that are bothering you. Great job.
Thank you. Yeah, thank you so much for joining me and joining Colleen. And we definitely want to make sure that you guys stay healthy, stay safe, wash your hands, keep social distancing. We will get through this.